Good evening. I'm Mary Steimer with C-SPAN. Tonight we're taking a special look at funding for syringe exchange programs, a very controversial topic with viewpoints on the issue largely divided amongst political party lines. Needle exchange programs were first introduced in the 1980s. At that time, state, local, and nonprofit programs solely provided funding. However, the ban on federal funding for needle exchange programs was lifted in 2009. The National Institutes of Health and the Institute of Medicine supported this effort. Earlier this year in January, federal funding was once again repealed. Without a doubt, funding for syringe exchange programs is a politically charged issue. Today we will explore this issue in depth with leading political and public health experts. Joining us first is Senator Gossett from Missouri. Ms. Gossett is a proponent of federal funding for needle exchange programs. Senator Gossett is also a member of the Labor and Health and Human Services Subcommittee. Senator Gossett, can you tell us more about your work to support federal funding for syringe and needle exchange programs?
Thank you, Mary. I serve on the Labor and Health and Human Services Appropriations Subcommittee, where the issue of federal funding for needle exchange programs has surfaced as a controversy. Our subcommittee has a history of attempting to let science, not politics, determine public health policy. The HIV epidemic remains an urgent public health problem. The U.S. Centers for Disease Control estimates 50,000 new HIV infections annually in the United States. The earliest official responses to AIDS in the United States expressed official fear and condemnation of victims and denial of the magnitude and seriousness of the population risks in the epidemic's early stages. These failures with AIDS prefigure current U.S. crises and general health policies and interfere with efforts to successfully inform public understanding of the meaning and value of scientific evidence. Numerous scientific bodies and governmental agencies, such as the American Medical Association, CDC, National Academy of Sciences, and the U.S. General Accounting Office, have all endorsed syringe exchange programs as an effective strategy in reducing the spread of HIV infection without increasing injection drug use among its participants. Various epidemiological and ethnographic studies have provided behavioral and operational evidence that regular participation in syringe exchange programs could slow the spread of HIV. Providing federal funding for needle exchange programs is also a solidly positive fiscal decision. I would like to present a cost-benefit analysis. As a national average of states with participating needle exchange programs, program operating costs per participant were an average of $117.93. In contrast, the antivirals for HIV can cost from $14,000 to $20,000 per year, to say nothing of the court costs and police overtime prosecuting drug users. Considering that 33 Americans are newly affected with HIV each day due to contaminated syringe equipment, national support for needle exchange could save tens of thousands of lives and billions of dollars. As the saying goes, an ounce of prevention is worth a pound of cure.
Senator Gossett, thank you so much for sharing your perspective with us. We will now turn to Senator Amy Hanula from Georgia, who was instrumental in reinstating the ban on federal funding earlier this year.
Thank you, Mary. The last time I checked, drugs were illegal in the United States. People using drugs should be arrested, not encouraged. Pro-IV drug use needle exchange programs give the wrong message that encourage the use of drugs and lead to an increase in drug use. Nobody wants to see a needle exchange program open in their community, leading to a decrease in their housing value and an increase in the number of dirty needles that will be on the street. According to the American Journal of Public Health, the HIV virus remains viable in a syringe for 3 to 5 weeks. I'm sure nobody wants their children playing in HIV or hepatitis-infected needles on the street. Federal dollars are better served on programs focused on decreased drug use in the United States, echoing the Jessica Say No campaign of the 1980s. I will continue to support this year's legislation banning funding for needle exchange programs. Thank you.
Finally, we will turn to experts who actually might know something about the issue directly. 2 nurse practitioners from Emory University. Brett Winston and Gina Kim are adult geriatric nurse practitioners affiliated with Emory and working in the Atlanta area. Thank you so much for joining me today. To start off, can you tell us why nurse practitioners are even involved in this issue? How does syringe exchange relate to the type of care they give patients?
Well, Mary, nurse practitioners, who I'm going to refer to as NPs from now on, as well as other primary care providers, play key roles in comprehensive care of patients. This includes other training, follow-up, and education that's necessary for this particular population, and includes diagnosing and treating other common illnesses on a day-to-day basis. Providers who work in HIV clinics or have patients living with HIV work very hard to manage their medication regimens and follow-up that's very specific to this population. It's not something we're averse to doing by any means, but it is very time and effort intensive to provide this type of education and care, and therefore we really need more focus on preventative education. When, for whatever reason, patients cannot afford their HIV medications and can't take them, the care becomes much more difficult to manage.
I know that your stance on syringe exchange is one of support. So could you explain why you support these programs, and in your opinion, what benefit it might have in addition to what we've already heard from our other experts?
As mentioned, these programs provide comprehensive care. What started as simply syringe exchange has become community and patient-centered care, assisting people with social services, health assessments, food and housing, vaccinations, which are extremely important for this population, screening, referrals, and other services they may not have access on a normal basis. Furthermore, as nurses, we are very focused on preventative care. Encouraging syringe exchange programs have huge public health benefits. Discouraging needle sharing is the first step to battling the spread of HIV and other blood-borne disease such as hepatitis. This would seem common sense, yet amidst controversy and moral arguments, we forget this fact. These programs are backed by many reputable and influential health organizations, including nursing organizations and groups. They realize that addressing risky behavior is more effective when we reduce stigma and create an open, non-judgmental environment. We have seen decreases in HIV prevalence in other countries and states with implementation of syringe exchange programs, so we know it works. This is why we support federal funding. We have seen how much money it saves.
Ms. Kim, how do you respond to the point of view that these programs encourage needle sharing or drug use and enable people to continue engaging in risky behaviors? It seems shouldn't we be teaching people to never use drugs in the first place?
We should always encourage abstinence as part of the comprehensive care, but the reality is abstinence is an obsolete message that should not be thrown at people who are injecting drugs already. It is likely a criticism that they hear often from others, and does not encourage them to seek health care, which could help put them on the right track to decreasing drug use, let alone doing their part to show the HIV transmission rate. An alternative approach is therefore necessary to meet people on the level that makes sense to them. We have also heard and seen in studies that it does not increase the number of users. It is understandable that people have moral conflict with this issue, but when we move past that, we should see that numbers and data are sound.
Needle exchange programs may be the first contact that injecting drug users have with health providers. And for many of them, they've historically had poor relationships with these providers, and they're jaded by that. If patients are jaded by us as providers, they're less likely to seek help, and therefore more at risk for needle sharing and blood-borne disease transmission, as mentioned by Gina already, hepatitis in addition to HIV. So as we push to raise awareness for HIV/AIDS and the stigma reduction for patients with HIV, we should also have an equal awareness of the benefits of these syringe exchange programs. It's not simply enough to tell people to stop doing drugs. Those who have addictions develop physical dependency on these substances, and it's not always enough to simply will away those desires. We must be accessible to patients so that, number one, we can continue to provide support and encouragement in order to help them to cease using these substances, and secondly, provide resources so that they'll have a way out. This includes the proper follow-up, education, even psychosocial interventions such as group therapy or mentor programs. Of course, we want people to make moral, right decisions, but this simply doesn't always happen all the time. There are even circumstances in which some people have no choice. We cannot hold ourselves to a higher standard and ignore people in need, people who are vulnerable to ostracism and isolation in our society. Therefore, NPs and providers who work with these patients understand their needs and can contribute to the fight against HIV transmission. The message is to prevent this transmission, and therefore, SEPs, syringe exchange programs,